Medical cannabis has been legalized since 2001, and the biggest stigma for this process are doctors who don't understand the benefits.
For our specific patient who's on it, we have it in two forms. One is as the dried leaves, like cannabis, and one is as the oil, which he takes under the tongue, so by oral administration to go directly there. For the dried herb, we pre-package it in little sachets that are like 0.25 grams, which is perfect for his dose to be able to take. And for the syringes, we do a similar thing, so depending what the dose would be, we pre-package them in exact amounts for him. So like that, it's actually easier for the nurses to administer it and to give it to the patient.
In my work in palliative care, it became clear to me that something patients were asking for back in the early days, and they were coming back with an improvement. They were sleeping better, they had better appetite, nausea was improved, pain was improved, a general feeling of well-being.
For medicinal cannabis, all patients have the right to be able to continue their usage during a hospitalization. We will assure that it is an appropriate supply from a licensed producer. But right now, it's still the responsibility of the patient to bring in their vaporizers with their filters in order to assure that there is no scent that exposes other patients or other healthcare professionals to the vaporizations of the smoked cannabis.